I'm Dr. Eva Njenga, physician endocrinologist, here with Ponea to talk about thyroid disorders. We come to the management of an overworking thyroid gland. So that's what we call hyperthyroidism. So once you've diagnosed and you've decided which you've been able as a health provider to see what type of hyperthyroidism. Is it the Graves' disease, which I mentioned, that comes with the eyes almost popping out? We call it an autoimmune disease as well. That you need to know, because the management of that may be much longer than just a toxic goiter. But we need to bring those hormones down. So there are two ways, there are two drugs that are used. And those ones, the physician or the endocrinologist will be able to discuss that with the patient. They do have their side effects. One is called carbimazole, the other one is called propiondiuracil. Both have side effects. And before you even start on those medications, you do baseline tests for the patient, including full hemoglobin, that's the level of the blood, and the liver function test. Because the one called propiondiuracil can have adverse effects on your liver function. The carbimazole sometimes can cause problems. Both can cause problems of itching, and those are the things, as I said, as you start any patient, you need any drug, on any drugs, discuss with them the possible side effects. Not everybody will experience these side effects. In fact, majority of patients have no side effects. But one patient with a liver damage because of a drug can be very serious. So it's important that you know and you monitor. Then the itching, that one you warn them that when it happens, just call your doctor. You'll be given something. If it is serious, we usually stop the drug and give it time and or change from one. If you are reacting to one, then you try the other one. And then, of course, there are other drugs that you give. For the Graves' disease, you sometimes have to combine with something called steroids, because if it's an autoimmune, there's antibodies fighting your thyroid gland. So sometimes you need to give them in combination with the steroids in the first phase of treatment, but those ones you also withdraw within 2 weeks. If it is patient who is presenting at those early stages of very severe eye involvement, you need to immediately bring in an eye specialist. And we do have eye specialists in this country that deal with thyroid diseases specifically, and you need to get in touch with them as early. That's why I talked about referral system. You get this patient in a country, you need to know the referral mechanisms so that this patient gets the help. At times with the patients, we are getting at very, very early stages when they're actually getting blind because of corneal damage, because they had those eyes protruding for so long and nobody knew what it was. So it's very, very important that you get that diagnosis early and you treat them properly. How long do you treat them? Hyperthyroidism, most of these drugs, you should not give them more than 2 years. So if you find that, and as you start with the high doses and you wean them down as they respond, you continue to monitor their thyroid hormone levels within intervals, sometimes initially every month, and then when they are stable every 3 months, then you wean them down until you get to a minimum. If you find that you cannot wean these patients of the drugs, that every time you reduce the dose, the hyperfunction comes back or the overproduction comes back, these are patients that you need to think of another line of treatment. One of them being surgery, removing of the thyroid gland, and then there's another one called radioiodine ablation, whereby they get a tagged iodine, which is radioactivated iodine, which goes specifically and targets the thyroid gland and kind of switches it off. So we call it's like medical ablation, and the other one is physically, surgically removing the thyroid gland. But those ones are all discussed with the patient, and you have to start to tell the patient from the start about all these lines of treatment of hyperthyroidism. I would like first to thank all of you, the Ponea team, and also thank anybody who is listening to this, wherever you are, whether you are a patient or not, to take this information, make yourself empowered to learn about this condition. Should you think that you have something in regard to this, it's important you can go on Ponea platforms. There's an app for patients. You can get the information where you can get more guided as to where to book to health professionals that deal with this. We have many specialists, endocrinologists, both for adults and for children as well. And we also have physicians who really also will be able to guide you, investigate you, and treat you or refer you to the correct specialists.